Good morning, everyone. I am Dr. Riza Lorenzana, Chair of Ako Para sa Bata 2020. The 12th Ako Para sa Bata is presented by the Child Protection Network Foundation and UNICEF. Our theme this year is Care of the Child Against Violence in the Time of Disease. Welcome to Webinar 3. We are glad that you are joining us again today. I will now introduce you to the moderator of the third Ako Para sa Bata webinar. She is a medical specialist too, a colleague, a child protection specialist of the Amang Rodriguez Memorial Medical Center. May I present to you the moderator of today's webinar, Dr. Namnama P. Villarta de Dios. Over to you, Dr. Nama.
Good morning. Good morning, everyone. Hello again, our dear Ako Para sa Bata community, the attendees logged in Zoom, and those watching via Facebook Live. Welcome again. Thank you for joining us today. Please follow the Ako Para sa Bata social media accounts flashed on screen for updates and other announcements. And if you will post about the Ako Para sa Bata webinars, please include the hashtag. So may hashtag sign COVID APSB 2020. So let's jump in. Today's webinar is about getting the women and children protection units COVID-19 ready. The objective of today's webinar is to present and discuss best medical practices and innovative solutions implemented to address challenges in handling cases during the COVID-19 pandemic. Hindi po na tumitigil ang mga concerns natin for protecting women and children. Hindi yan kayang i-stop ng virus. And if you were listening in, tuning into during the first session, the first webinar, Dr. Madrid has highlighted that there's we're expecting an increase, though we have not seen the recorded cases yet. So we have representatives from the different women and children protection units today to speak about best practices of WCPUs during the COVID-19 pandemic. For those of you who are not familiar with CPN, CPN is a non-government organization with expertise on the prevention and treatment of child abuse. One of the 5 pillars of the foundation is to increase the accessibility of services for abused children in the Philippines. CPN plays a crucial role in the establishment of WCPUs in DOH-retained and LGU-assisted and supported hospitals and training of competent multidisciplinary teams. There are currently 113 women and children protection units in 57 provinces and 10 independent cities in the Philippines. That's more than 88,000 children and adolescents to have been served. You may access the WCPU directory at the Child Protection Network website, and the link is flashed right now on screen. Today's webinar format is a panel discussion followed by a Q&A. We have 5 panelists, women and children protection unit members from Baguio, Bataan, Cebu, Davao, and Manila. For the open forum, we will choose among the questions in the Q&A box. Again, if you have questions that you want the speakers to address, please type them in the Q&A box and not in the chat box. Thank you. So, without further ado, let me now introduce you to our panelists. Panelist number 1 is a medical specialist too and head of the WCPU of the Baguio General Hospital Medical Center. Let's all welcome Dr. Elizabeth J. Batino. Hi, Doc.
Hello. Good morning to everyone.
Good morning, Dr. Batino. Next up is a medical officer for head of the WCPU and assistant head of Haven of the Bataan General Hospital Medical Center. Let's all welcome Dr. Maria Almira Arquiat. Hi, Doctora. Hi, Dr. Kiat. We'll move forward. Next is a medical specialist too Famous ito sa mga nag-train, especially under CPU PGH. Yes. Yeah. So our next panelist is Medical Specialist 2 and Medical Services Head of the Philippine General Hospital Child Protection Unit. Ladies and gentlemen, may I present Dr. Merle P. Tan.
Magandang umaga sa lahat.
Magandang umaga rin po sa inyo, Dr. Tan. Next is a medical specialist 4 and chairperson of the Department of Obstetrics and Gynecology from the Southern Philippines Medical Center in Davao City. Let us all welcome Dr. Lynette L. Lasala. Hi, Doc.
Hi, good morning.
Good morning. Yes, good morning, Dr. Lasala. Great to have you. Next is a medical specialist 3 and coordinator of the Women and Children Protection Center of the Vicente Soto Memorial Medical Center, Cebu City. May I present to you Dr. Madeline Mildred Rita G. Amadora. Doc Maddie, good morning.
Hello, good morning, a pleasant morning to everyone, and thank you for the invitation.
The pleasure is ours, Doctora. So, welcome panelists. I will be asking a total of 6 questions. Aarangkada na po tayo. You will answer them one by one. So let's just do this by alphabetical order according to the name of the hospital. Okay. So first will be Baguio Gen, and then followed by Bataan General Hospital, and then Philippine General Hospital, then Southern Philippines Medical Center, and then Vicente Soto Memorial Medical Center. You will be given a specific time to answer each question, and then I will alert you when the time is up. So let's start. Question number 1. Let's discuss context first. What happened to your unit when the COVID-19 pandemic started? And how did the quarantine measures affect the number of cases you saw? So best effort, 2 minutes per 2 minutes per institution to answer the question about context. What happened and what did you do, and what was the effect? What was the effect of the number of cases you saw with the quarantine measures you implemented? Let's start with Dr. Batino from Baguio General Hospital and Medical Center. Go ahead, Dr. Batino.
Good morning. Okay, when the pandemic started, there was, of course, chaos. Baguio General Hospital and Medical Center, being one of the designated COVID referral hospitals, reshuffled wards and offices to accommodate the influx of COVID patients. Of course, WCPU, BGHMC was not spared. Despite it all, services were maintained, except for a few, like the psychological evaluation of the patients who were scheduled at that time. And to deliver our services efficiently, we followed some practices like the use of Viber and email to evaluate the photos referred to us by our residents. Aside from that, we also use telecounseling, webinars, and teleconsultation. With regards to the second question, reported cases of abuse dropped drastically, as you can see on the screen on April. Okay, this bar graph shows the number of cases seen from January to August 2020. There was a sudden drop of cases reported to the WCPU during the strict implementation of the enhanced community quarantine in the month of April. Seeing 3 to 4 new patients a day, we came down to only 0 to 1 new patients a day. But as we adapt, we devise ways to reach out to our clients by starting teleconsultation and phone consultation, as shown by the black bar. Okay? Then there was an increase in face-to-face consultation as shown by the orange bar in June. Why was this so? Since then, since June, in Baguio City, this has been to put on to general community quarantine. In this slide, you will see 3 bar graphs. Let's go to the first bar graph. This shows the sexual abuse cases among women and children from January to August 2020. Comparing with our past data, even with the pandemic, our census continued to show that sexual abuse is prevalent in children, while physical abuse is the prevailing form of abuse in women. There were more reported cases of neglect and psychological abuse during the pandemic, as shown in the third bar graph. Oh, okay, let's focus on the third bar graph. There is a number there, as you can see, 1 in August. What's this? I would just like to share with you that during that month, we had 1 abortion. This abortion is a 2-month-old baby, and the perpetrators were both parents. This shows that a tremendous effect during the COVID period. Thank you.
That was a handful of information. So let's just move forward with our panel discussion. Let's go to Bataan General Hospital and Medical Center to provide for us the context and the effect of the cases they've seen with the quarantine measures that they implemented during the time. Let's call on Dr. Kiat. Over to you, Dr. Kiat.
Thank you, Dr. In Bataan General Hospital and Medical Center, when this pandemic started, the unit continued its services with precautionary measures except on April, when the entire hospital was locked down due to the increased number of COVID-19 positive healthcare workers. During the lockdown, aside from containing the spread of the virus, this gave us time to lay out strategies in our workforce and delivery services. Now, the left chart, as you can see, shows the decline number of clients this year due to the quarantine. The right chart, this shows the increasing trend after the lockdown, which was in April. There was increasing trend after the lockdown. Until now, our institution is still closed for outpatient services, being a COVID referral center in Bataan, except for our unit, the WCPU. The unit resumed its function right after the hospital lockdown. Now, here, compared to the previous year, same month from March to August, we have a decline in the number of cases, but being sexual abuse still has the highest number compared with physical abuse. And comparing this with adult cases, child versus adult cases, the red for children having the highest case seen both for sexual and physical abuse.
All right, thank you so much, Dr. Kiat, for those insights, for that information. Let's move to CPU PGH to provide us with context and the effect of the cases in terms of number of patients seen during the start of the pandemic. Let's go to Dr. Merle Tan.
As for Child Protection Unit PGH, we believe disaster and a pandemic such as we were into, children are very vulnerable to abuse. So we never closed our unit, and our services were being offered. So what we did was to prepare on how to operate. First, we have to understand and learn measures to protect patients and CPU staff. So we have to read journals, watch webinars, and learn from the expert and ask even our infectious disease expert from PGH to seek wisdom from them. So our IDS consultant visited their unit and gave recommendations. From there, we made guidelines on how CPU will operate during pandemic. So these are the several changes to modify during this pandemic. We have to look at our environment. We have to look at our triaging. We have to look at how do we do our medical history, physical exam, and medical treatment, as well as doing intake. We have to look at psychotherapy, home visitation, case conferences, legal consults, sworn statement, forensic interview, as well as our court hearing. And then we have to look into staff reduction risk and training of staff. So as you can see on the chart, we compared new medical patient wherein there was really a drop of patient during the ECQ. But if you look at the part wherein there's increasing number of patients coming in, that was around July, wherein we had our general community quarantine. Patient coming in to CPU for examination. We used to see about 10 patients, 5 to 10 patients per day pre-COVID. And then during COVID, this dropped to about 0 to 1 patient. And during GCQ, they start to come in. So we see around 3 to 6 patients per day already. For our psych screening, this went down again, but so we have to innovate some changes for our psych. So while patient is waiting, they're already being screened by our psychiatrist or psychologist. And we also refer for any immediate or emergency psychiatry referral for suicide and patient who wants to harm themselves. So during ECQ, it's really hard for us, but it's a time for us to adjust to this challenging times.
Right now, let's go to Southern Philippines Medical Center. Let's hear from Dr. Lasala with regards to providing context for the hospital.
Good morning.
Morning.
I would like to thank CPN first for inviting me to share how SPMC, Women and Children Protection Unit, coped up with the challenges during this pandemic and how we embrace the new norm. In SPMC, we are the COVID center in Davao City. Hence, we were expected that there will be a lot of challenges along the way as we move towards ECQ. But nevertheless, the services of SPMC WCPU continued. However, the most challenging part was the unit was relocated, coming from the main hospital wherein we were housed. In the second level of the main hospital, we had to be transferred to the outpatient department. So there were a lot of transfers of offices and units. How did the quarantine measures affect the number of cases seen? We noticed that there was a marked decrease in the number of patients when the quarantine started. The next slide will show us that we received lesser number of cases seen during March. That's February and March. But comparing it with 2019 census, it seemed that 2020 had the same trend. As we eased down from ECQ, there was actually steady rise in the patients that we see from May to June. This slide depicts physical and psychological abuse showing highest numbers in January. And as we entered ECQ in March, a decline is very noticeable. What is unique is that there was an almost zero report of abuse in April and May of 2020 when the ECQ was strictly implemented in Davao City. This slide shows us that the first half of 2020, SPMC WCPU experienced a 38% and a 45% drop in the number of sexual and physical abuse, respectively.
Thank you so much, Dr. Lasala. Now let's go to the experience of Vicente So Memorial Medical Center. Let's listen to Dr. Amadora. Over to you, Dr. Amadora.
Thank you very much. I would like to tell you about our experiences at the Women and Children Protection Center. Let me tell you first what is our unit. We were established March 8th of 1998 at the Vicente Soto Memorial Medical Center, and we are famously known as the Pink Center. During this Vicente Soto Memorial Medical Center was one of the pioneers of the hospital all over the Philippines to establish the Women and Children Protection Unit. And during the pandemic, prior to the pandemic, we were able to celebrate the 24th anniversary of the Pink Center. And during lockdown, which was March 28th, we never expected that of the 24th year of existence of the Pink Center, it will be closed. Because May 20, we had one positive COVID positive among the staff, and followed by nine, and 3 of which were hospitalized. So we don't have any choice but to close the center from May 22 to May 28. So this is the site wherein the Pink Center was disinfected. And then it is such a sad sight wherein we see the Pink Center that was vibrant, lively before, it becomes gray. We were full of uncertainties and fear. What will happen to the Pink Center? What will happen to the staff? What will happen to the patients? And what will happen to our family if we get infected? So it was the most hardest part of the Pink Center. So I'm showing to you the statistics, comparing the 2019 statistics. Were in last year we had a total of 6,833 clients going to the center, and we saw, and comparing to the 2020 statistics, we had a total of 1,707 patients only. It was really a drop of patients coming to the center. Compared to that of the 2019, where in January to August, we almost accounted for almost 5,000 clients compared to the 1,707. And in these statistics, still, sexual abuse is the #1 cases we see at the Pink Center. And we saw a trend wherein our cases are mostly perpetrated by family members, like stepfather, live-in partners of mother, boyfriend of mother, or even fathers, cousins, and brothers. So at present, we are already operational, and we are accepting acute and non-acute cases already. Thank you very much.
Thank you so much, Dr. Amadora. So, what is common, pertinent dun sa mga napag-usapan ngayon, like taking off from the last speaker, Dr. Amadora, as child protection specialists and frontliners in the CPU, we get to wrestle with our own humanity. There's a lot of uncertainty and a lot of fear. But what's good about this is, after acknowledging it, tutuloy lang tayo, and that's the common theme among the experiences of the 5 institutions represented here in this panel discussion. So different measures to disinfect, that was repeated in several of the speakers, involving other people and other experts to help, that to help us in formulating guidelines and actually implementing them is another. And these things, despite the lockdown, nakikita talaga yung resilience ng mga WCPUs. Let's talk about physical setup. What are the changes? This is the second question. What are the changes in the physical infrastructure and equipment that your unit adapted to prevent COVID-19 transmission? So ang unique lang, I think, dun sa 5 institutions, one of us, yung sa Southern Philippines, I think, Medical Center, nagkaroon ng relocation. But as far as the other institutions, parang we stayed put. So we'll have 3 minutes each. So best effort again. Let's talk about physical setup with regards changes in the structure to make the WCPU functional. What was the experience first off with Baguio General Hospital and Medical Center? Dr. Batino, floor is yours.
Hello? Okay.
Go ahead, Dr. Batino.
Just like Southern Philippines, during the pandemic, areas of the hospitals were divided into clean and dirty areas, meaning to say clean non-COVID and the dirty areas, those who are positive for COVID. The building beside our old office was converted into a COVID unit. So we transferred actually to the outpatient department together with the clean emergency room. Now, showing to you the first photo, room 306. Go back, please. Okay, that's the social workers room. It is a separate room from the interview room or interview and physical examination room, room 307. Okay, now let's go inside that physical interview room. It is equipped with a zinc, and there is a room going at the back. It has also a separate comfort room for the employees. As regards to the comfort room for the patients, it is also separate. This physical examination room has an acrylic box which is used during the perineal examination of our clients. Okay, and as you can see, the examination bed is not already with a cover just to prevent the contamination and it saves us time to disinfection issues. Okay, additional measures are, as you can see, that's plastic barriers. There were more bottles of alcohol provided just before entering our examination room and the social workers room. And disinfecting the area every morning is also implemented. Next, let's go to the other photos. Okay, as you can see there, the room is always open for better ventilation once the patient has been managed accordingly. Okay, that is our old WCPU. Okay, because of the limited space in the new unit, which is as I've shown in the OPD, our services such as the psychological evaluation, telecounseling, face-to-face counseling, and telehearing had to be conducted at this old office. Protective barriers were also installed to ensure everybody's safety. Thank you.
Thank you very much, Dr. Batino. Now let's go to Bataan General Hospital and Medical Center. Let's hear From Dr. Kiat, the measures they took with regards changing physical setup. Kamusta po sa Bataan General Hospital WCP? Dr. Kiat?
Yes po. Since all OPD offices were closed, these are the temporary offices provided for the WCPU so as not to disrupt the operation and provide a safe place for the victims as well as the staff. You can see we would transfer offices from time to time depending on the surge of COVID patients in the hospital, since our hospital is a COVID referral center in Bataan. Wherever is safer for our clients and staff, of course. For the next slide, this is the Blue Med tent with negative pressure capability provided by our governor, Abet Garcia, that we are using. Since we don't swab patients coming to us for assistance and consult, we treat all clients as COVID positive. So this is to ensure protection for the healthcare workers in our unit.
So let's go to South naman, to Philippine General Hospital. Dr. Tan, how were changes during the pandemic with regards physical setup, Dr. Tan?
Just like all WCPUs, we divided our unit into clean and suspected for COVID examining area as well as interview room. So for clean patient, they are seen at CPU proper, and we converted our annex that used to be a training area and conference room to a suspected for COVID interview and examining room. Initially, we place barriers like plastic and acrylic in our CPU, both annex and CPU proper. But with the advice of our IDS consultant that barriers are not necessary anymore, so we removed it. So right now, this is CPU proper. As you can see, the waiting area is now divided into two. We have a main, this used to be our waiting area. This now used as a waiting area for clean, and as well as a waiting area for if you're the next patient to be examined. And as you can see, there are no plastic barrier. The plastic barrier was only in that counter. And if you look at the small portion near the smiley emoticons, we avoid touching or giving things. So we insert all the medical certificate or whatever documents, we have to handle it to them through that small hole. So we also provided shoes for our CPU staff. So whenever they come in, they have to change shoes, and we constantly practice social distancing. That's why you'll see the distance of each. So as part of how to take care and prevent COVID, each room were installed exhaust fan, and then all rooms are provided with alcohol, and we indicated numbers of person to occupy per room with reminders of social distancing. We also placed educational materials, infographics in our triage area. So you'll see there some posting of no face mask, no face shield, no entry. And then there are infographics of social distancing, hand hygiene, face mask, and face shield. So separating the examining room, before, we used to have a waiting area just outside of our CPU. With the help of our PGH director, we were able to get the area of this used to be a canteen. We were able to get a place where our patient can wait. So this is our new waiting. So when you go into our new waiting area, there's a one-way path. So which means you enter from here and you exit on the other side. So when you enter, there's a provision for alcohol, and on the right corner, there's a sink wherein they could wash their hands. And this waiting area is being monitored inside CPU proper. So there's a CCTV. If you look at the other picture, there's a CCTV wherein the triage officer inside the CPU proper can be able to monitor that they really practicing social distancing. They have to wear masks and face shield. If they don't have a mask, like if they only have a cloth mask, then we provide them with a surgical mask. And if they don't have a face shield, we provide them with a face shield. So on the left picture, this is our annex. We converted it to interview room, and there's a portion wherein there's an examining room. We are still going to renovate this one so that there'll be a cubicle for interview room and a cubicle for examining room for suspected COVID patient. And as I've said, all our rooms have exhaust fan. We remove from our examining room, we remove everything, all the toys, and then we don't use any more bed sheet. What we use is underpads. And even our play area or playroom, we converted it to telemedicine and doning area. So we have a doning area and doffing area. We made sure that there's a proper bin or a plastic wherein we could place our PPEs and gloves. Every use of our PE room and examining room and interview room, we usually disinfect after patient. But every week we make sure that weekend we made sure that the whole unit will be disinfected as to make sure that everything is clean prior to the following week. Over.
Thank you very much, Dr. Tan. Ang aliwalas nung waiting area, that's new to me. How nice. We had a lot of changes in the physical setup. We'll just summarize later on. Let's go to Southern Philippines Medical Center. Dr. Lasala, what were the changes with regards the physical setup of your WCPU? Over to you, Dr. Lasala.
Yeah, as I've said earlier, the challenging portion was really to transfer from a unit being housed in the main hospital in the main building. We had to transfer to the second floor of the outpatient department. And we were given 2 adjoining rooms by the administration. And before we set up the unit, the Infection Control Committee suggested certain things that should be done for the unit. So before we have a really quite big area for the unit, we have an examining room, we have an interview room. Our social workers also have their cubicles wherein they can do their intake interview. But right now, we have to do with what we have. And these adjoining rooms were turned into one that is an interview room and the other one is the examination room. If you can see in the 4 pictures below the slide, the first photo on your left side of your screen shows that barriers were placed. And the second photo, you can see just an examining table, which is not covered by anything. to prevent possibility of transmission of the COVID-19. You would also notice there's a curtain on the corner of that room. We had to improvise because there is no we do not have any changing room or a comfort room for the patients. They have to go out of these two adjoining rooms to go to the common area. But we cannot do that, so we had to improvise. And that corner over there, covered by a curtain, is where she can undress and change into a patient's gown. So you would see that the next two photos on your right would also show how the setup has been changed, and we just really had to do with smaller areas for this unit. We have our resident rotators coming from the pedia department and from the obstetrics and gynecology department still rotate in the unit. And when they see patients, our social workers call them when patients come in for an examination, and all our workforce wear the level 3 PPE. At the same time, disinfection is also being done before we start the day. And at the same time, there are UV lights with HEPA filters in SPMC. However, these UV lights with HEPA filters are usually allocated in the COVID zones. So this is how we embraced the new unit that we have. From a big one to a very comfortable one, we had to do with what we have. But still, we are proud to say that our service has continued. Thank you.
So far, dun sa apat na naging speakers natin, ang dami po, no, ng changes na ginawa nila with regards physical setup. But I think the principles of na nilatag ng DOH sa atin with regards the prevention of COVID-19 in our workplaces were being considered always. So yung mga best practices na shinare po would be ensuring that there is physical distancing, avoiding close contact. So sa PGH, may level up na CCTV monitoring, but in the other medical centers with WCPUs, ang mga common practices will be the social distancing, dumami ang mga alcohol. Some have barriers, but in PGH, with in close coordination with IDS, the infectious disease specialists, sinasabi nila that it's not needed. But I think yung advantage din ng CPU PGH is that they have extra space with the support of the PGH medical director. So nagkaroon sila ng expanded na waiting area. That's so good. It's so cool. Tapos nagkaroon sila ng, ayun din yung isang common, separating yung clean at saka yung mga suspects. All right. And ensuring as much as possible that there's ventilation. So open, may mga open na doors and windows, or putting an exhaust fan. So all good. Dr. Amadora, you're here?
Presenting to you our audio video room. Unfortunately, it's aircon and it's closed. So this was the physical setup before. This is the Women and Children Protection Center, the front area. Next, okay, this is the receiving area before. I'm presenting to you the before the pandemic. Receiving area wherein the patient will wait for their turn to be interviewed and examined. So this is our playroom. Before, it was full of toys. So this is our play therapy room, which was located on the second floor. The psychologists do play therapy on our children for psychological evaluation. Okay, this is the nurses station before, wherein there's no barrier. And then this is our only examination room. This is adjacent to the nurses station we're in. We do our daily endorsement, and the photos below is where patients are being interviewed, as well as the social worker do the intake and do risk assessment. And this is the staff room, which is located on the second floor. That's the kitchen. And the two doors in the kitchen where we house patients who need to be sheltered 24 hours. So during the pandemic, everything changed. We have to make change setup. So we converted, this is the proposed, before we proposed to the ICC that this will be the setup. All first floor will be used for the patients and nobody can go up to the second floor anymore. So we divided the pink center into the red zone and the green zone. The red zone, we mean that those who are COVID suspect or COVID suspects, and as well as the green zone. But unfortunately nowadays, we examine all the patient at the red zone area. So plastic barriers were installed, and this is now the setup. If you go inside the pink center, there's a green zone and the red zone. Remember the waiting area before? We cannot let the patient go inside already at the pink center. So we have a ramp outside the pink center, and then we installed roof made up of tarpaulin, and we provided chairs there for them to wait. Okay. The security guard is the one who will inform us that patients are there or the next patient will be the next. He will be the one who traffic the patient. Now, during the COVID pandemic also, no aircon was used. All windows are opened, and then we installed exhaust. So these are now the two examination room. One examination room at the green zone and one examination room at the red zone. The picture below is the examination room at the red zone. This was converted from the police officer office room, the police officer room. So it was converted to examination room. And then all books, all toys are kept for storage.
Okay, thank you, Dr. Amadora. So, right, similar also to the other WCPUs represented in this panel discussion. A lot of planning was put into consideration to separate those who are COVID suspects from those who were assessed and found na walang less or no risk from the virus. So clean and dirty sa ibang institutions for FPMC sorry for Vicente Soto, it's red and green. Yung security guard ang nagmo-monitor. Sa PGH naman, meron tayong CCTV. Again, I'd like to emphasize din the WCPUs discussing here also made sure na there would be less of contact, less touching of contact surfaces. So tanggal lahat ng toys and books, no, for us to tide over this season of the pandemic. Right. So let's discuss naman new protocols that are implemented. So for all of the panelists, again, we'll follow the alphabetical order of the institutions. This is the third question. What are the new measures placed or new protocols implemented in your unit to ensure the health and safety of your patients and employees? So, Baguio General Hospital and Medical Center, Dr. Batino, can you discuss with us new protocols implemented in your WCPU?
Okay, as you can see from the slide, this is the clinical algorithm we follow. The boom triage serves as the initial triage. All patients undergo temperature checking and signing of the health declaration form. A stamp is placed on their hand or lower arm as proof of triage. Okay, going to the right arm, the non-COVID patients For the non-COVID patients, they are directed to the clean ER or OPD, then to the WCPU, serving as the second triage. Here, the staff still wear the minimum PPEs. In the WCPU unit, patients are managed accordingly. In cases where transport of the patient poses a problem, the Baguio City Police Office assists in the transport of patients. Going to the other arm, for COVID probable, suspect, or possible patients, they are referred to the COVID ER, and proper coordination with the WCPU staff is done. Now, when patients are admitted at the hospital, the Women and Children Protection Unit interventions are provided prior to their discharge and when the COVID tests are negative. Okay, the first photo shows the area where the start of the triage is. So we have that boom when patients are, or the guardians are inside their car, they should be checked by the triage personnel. Health pass is obtained prior to having their checkup in the hospital. This just shows the signing of the declaration form of the clients. Triage area, that's the area wherein the patients go to the garden where they will be triaged. There, showing to you inside the garden area wherein there are several wash areas. After their consultation, they have the other exit. So entrance is separated from the exit points. Okay. For the COVID patients, suspect and probable, they go to the emergency room. This serves as the second triage. Before going to the emergency room, there is a tent or a makeshift tent. Now, we have for the employees, we have temperature check before they come into the hospital. And proper PPE like face shield and surgical mask should be worn before entering our room. We have our foot bath around the hospital, and the use of minimum PPE is observed by our social workers and doctors all the time. To monitor employees' health, the hospital created employees' health tracker using a Google form to be filled up daily. This serves as our health declaration form. Okay. There is also a mandatory mental health screening assessment. In terms of work schedule, we have an alternative work arrangement, either work from home or a compressed schedule. It used to be 8 hours, and then during the pandemic, compressed time such as the 10 hours daily work. The hospital also provided free flu vaccines for all employees. Aside from that, employees are provided transport support to and from their homes. Physical distancing during break time is observed. Referral of residents to doctors to WCPU consultants on call can be done through the Viber, which we implement.
All right.
Thank you.
Thank you so much, Dr. Batino. Let's move to Bataan General Hospital and Medical Center. Dr. Kiat, what were the policies that you implemented to help the people and the patients and the workers with COVID-19?
Okay, part of our measures in ensuring the health and safety of everyone, we have our disinfecting team. This is our disinfecting team with the UVC robot. And since we do not know, next slide please, we do not know our client's COVID status, regular disinfection of our units being done using 3 steps. These are the detox or yes, the hydrogen peroxide pulverization device, then Next step is the wall-to-wall cleaning, and the third is the UV light using the UVC robot. To ensure the health and safety of our patients and our safety, we revised some protocols. Here is our new workflow. First, the police officer refer cases for medical legal examination related to women and child abuse via phone call. The social service, the social worker usually receives the call and makes the initial safety assessment on the client over the phone. Then she will schedule the patient for to come to our hospital, because as I've said, the hospital became the referring hospital for COVID patients only. So we only accept COVID suspect, probable or COVID positive patients, except for our unit. So we don't have a clean area in the hospital. Immediate coordination with the child protection specialist or the medical officer. If in quest, the social worker will assist the medical officer in examining the patient. And before the patient comes to our hospital, the social worker will coordinate first to the triage officer and the record section for faster consult. Then upon receiving, when the patient comes, the triage officer will screen both patient and parent or guardian and make sure that they have face mask and shield before coming to our unit. Upon receiving of patient, I do the usual intake interview and the medical legal examinations. Then the record section will release the certificate. Usually the patient will wait at the triage tent. This letter was disseminated to all barangays and police stations to let them know that we are operational and that coordination is encouraged. So we place our landlines and our mobile phone here for proper coordination. We used, in examining the patient, we use type A PPE. This is a powered air purifying respirator provided by the hospital. I also use lapel mic for easy communication. Given the limitations of quarantine, these are the adjustments made to make the unit accessible. We have a temporary unit placed near the triage area. Transportations are provided by their barangay or police officers handling the case. We also make sure to attend to all cases despite skeletal workforce.
Thank you. I was saying now about with the experience of Bata and Jen, walang difference between, wala silang clean and dirty kagaya ng ibang institutions, but that should not be a deterrent. So they made steps to protect themselves. So thank you for that. Dr. Tan, what is the moving forward of CPU PGH with regards policies and implementing them, the new protocols?
Yeah. For us, the protocol was created and revised accordingly. So, depending on how COVID situation. So, very fluid kasi ngayon eh. So, kailangan, if you look at our protocol, kailangan ano rin yan eh. It now sway or dance with how COVID is moving and what changes can be done. So, meron niyang evaluation palagi. So what we did was to cascade to the staff. So we had a one-day orientation regarding the protocol. And then monthly, we have a monthly Zoom meeting. So all staff was aware of the protocol. So nasa admin namin yan. So they also revise depending on the discipline. So if the social worker wanted this, they can revise. The medical wanted this, they can revise. So very fluid. Kailangan all of us has to brace changes. So, but we have to cascade all the changes and to the staff. So for our new protocol, we do self-check prior to going to CPU. That's a must. Make sure that before going to work, you have to look into your well-being. Kung meron kang sipon, ubo, then better not to go to CPU. Ang principle kasi is to protect yourself, protect patient, and protect others. So that's the basic principle na lagi nating iintindihin. So we also monitor temperature whoever enters to to CPU, and as well as give health declaration for patient who will be classified as low, then they go to CPU proper for interview and examination. But if you kung medium, then you go to the annex. But if you're high, possible COVID ka or COVID positive ka, then you go to PER. Checking the temperature has to be regular. So dun pa lang sa may pagpasok mo pa lang dun sa waiting area, they have temperature check. And dun rin ginagawa yung weighing. Nandun na yung weighing scale. So no mask, no face shield, no entry. The triage officer give information of the health declaration, and they have to look into kung ano yung mga may check doon na yes. And then aside from that, we ask them to check where their barangay is. If the barangay has high incidence or even neighboring neighbors ng patient have incident of COVID, then we make sure na they'll be seen at the annex. Pre-COVID, we usually have several companions ng aming mga pasyente. So right now, we minimize companions, so one companion per patient. And also pre-COVID, we ask the patient companion to go to Pedia ER or to get their chart and information, to get it from the record section. Presently, we coordinated with the record section, so they don't go to the record section anymore. What they do is just fill up the form, and then we email this to our record section. The record section will give us a chart by email, and then the hard copy will be delivered by the record personnel. So we also have provision of COVID kit per staff. So they have the mask, shoes, PPE, face shield, goggles. We also have our doffing and donning area, and then we make sure that we have a disinfectant because we have to reuse our N95 or KN95 and goggles. So we have now a UV box where we can disinfect our items, our personal items as well. So we use level 3, at least level 3 PPE. We only use level 4 if we're going to ER to see referral for possible abuse, which is COVID positive or COVID suspect at the ER. So minimum of level 3 for all staff. We gave also our staff, can you go back to the previous slide? We also gave flu vaccine, free flu vaccine to all staff. So we have assigned donning and doffing area. Okay. So all of the staff were swab care of PGH as requirement of PGH. Lo and behold, we're all negative at that time, last July. But some of our staff became positive. So that's the time we have to ask help from UPHS or the University of the Philippines Health Services. So they monitor our staff, and they'll give advice. So as well, we also had the division of teams. During ECQ, we divided our teams into two teams, Team A and Team B, and then went back during GCQ. All the staff went back to our unit, but unfortunately, because of the incidence of COVID positive, we have again to divide to protect our staff and to keep our operation. We divide our staff to two teams. So some of our staff would work at home for a week and then go to work for 1 week. So this is our health declaration. It's we converted it into Tagalog. So if you have yes answer, then we will reevaluate if you're going to do the annex or not. For the staff, if you have, this is also the self assessment before going to work. If you have a yes answer to this, then better not to go to work and have yourself seen by UPHS consultant through telemedicine. Next slide, please. So the principle is actually to minimize face-to-face encounter. So what we usually tell the staff, yeah, that's the right. The principle is less face-to-face encounter. So as part of innovation, the social worker, instead of doing all the intakes, they ask the guardians or parents to fill in this form so that to lessen encounter, because the principle is about 15 minutes to 30 minutes face-to-face encounter. So far, we're doing telehealth now to the different disciplines. So teleconferencing, telepsych, and even our court hearing are all via online.
Right.
So that's it.
Great. Thank you, Dr. Tan. So a lot of changes and revisions. And I like what you said, that kinakailangan na we talk about things so that we can always tweak and adjust. Right, let's go to Southern Philippines Medical Center. Kumusta po, Dr. Lasala, with regards the implementing of new policies sa WCPU nila?
Sa dalawa tatlo, magtago na kayo. Wala sa harap, wala sa likod, eto na ako.
I like the way, I like the way Dr. Merle Tan said, nakikisayaw tayo. No? We are very fluid with what is happening. And that is what happened with SPMC. There were a lot of hospital memorandums that were issued and implemented so that we will not only ensure safety of patients, but also the safety of the employees. So this slide will show us the issuance of memorandums such as restrictions of mass gatherings, the strict implementation of wearing a face mask and a face shield, and the use of rational use of PPEs, as well as yung disinfectant solution preparation and how we had to go about not transmitting the coronavirus from one patient to another, or from one employee to a patient, or from an employee to an employee. But sad to say, we cannot do away with the possibility of transmitting kasi nga we do not know the behavior of this virus. So we have new protocols right now. Initially, when the patient comes, when an abused patient comes, she is triaged by the ER doctor or nurse. And once cleared from the symptoms, going through temperature check and a lot of possibility of symptoms, pag na-clear ang pasyente, the patient and the watcher are given the WCPU pass slip and they may proceed to the OPD. So pupunta po sila to the second floor of the outpatient department. And when they arrive sa JICA building, that's the OPD, they will have to present the WCPU pass slip to the security personnel. And the patient as well as the watcher passes through the smart anti-pandemic booth. In the WCPU, they will be met by the nurse on duty, the nurse on duty receives the referral form, and the patient and her watcher will be instructed to wait at the welcome area for their number to be called. So, hindi naman ganoon kadaming pasyente. So, we ensure that when they stay in the welcome area, we still practice and we still implement social distancing. So for the interview, once the number of the patient is called, she proceeds to door 3, where the interview will be done by the social worker on duty. Of course, there is the presence of alcohol sanitation sprays in the footpath before this patient is allowed entry. So once the interview is done, this patient is instructed to be staying in the holding area. Then tatawagin po siya to proceed to door 2, which is where the examination happens. No? So the examination will be performed by either the pedia or the OB rotator. They usually go on specialty rotations. No? It's either a month or 2, and they are assisted by the nurse on duty. Still to ensure that they are safe from transmitting or possibly be infected with COVID virus, they also wear level 3 PPE. So after the examination, they go through again alcohol sanitation spray and foot bath before they are asked to wait in the holding area. So while they are waiting, the social worker will now prepare the medical certificate, medical legal certificate. And once it is done, that is the time that it will be released. We also have screening forms for watchers. So just like in PGH, they have the health declaration form, we also have the patient's watcher screening form. We make sure that there is no transmission from one person to another, so strict implementation of the face mask and the face. So the WCPU, as I've said earlier, has continued its services, and we are open from Monday to Friday from 8 o'clock in the morning up to 4 in the afternoon. But during weekends and on holidays, the emergency room department attends to the cases of VAUC. And as I've said, if they come through the OBER, it's the OB resident who assesses this patient, and if and when tagged as non-COVID, then if it is chronic, then they will have to be seen in the WCPU on weekdays. But if and when it is an acute case, then it is the OB resident or the pedia resident who issues the medical certificate. Thank you.
Thank you, Dr. Lasala. So we have to pace ourselves and go faster because there are still questions after this. Let's go to the experience of Vicente Soto Memorial Medical Center. Dr. Amadora, kumusta po ang ating protocol changes, if there are any? I'm sure there are. And how did you implement them? Dr. Amadora?
Okay. Regarding the protocol of the Women and Children Protection Center. So as what I said, COVID really changed everything at the Women and Children Protection Center. Okay. All going inside the Pink Center we have a foot bath in front of it, and the security guard will make assurance that all are taken temperature and all hands are being sprayed with alcohol. And another thing, we also provided face masks and face shield to patients, and all our staff are wearing face masks and face shield. So most of our clients seen by the patient are by appointment basis, especially the chronic cases. But in cases wherein it's an acute case, there's bleeding or discharges, or the perpetrator is detained, that's the time we see patients. So more or less in a day, we see about 4 to 6 patients in a day. So the nurse will take the calls from other partner agencies like the DSWD calls, we have our WCPC email also, and telephones. And then they are the one who take the intake of the patients, and they schedule also, they set appointment for the patients where they are going to come to the Pink Center for medical examination. And prior to that, all of our patients are being assessed by the social worker for safety assessment to make sure that are safe. So once the patient comes into the Pink Center, the doctor will see the patient. Can you go back, please? Can you go back of the first slide? Okay. Anyway, the picture below, the doctor will be the one to interview the patient, and usually the doctor are seated in a table, and then with social distancing, and the patient is seen inside. The patient is waiting at the red zone. Okay, the demarcated by the plastic. Next, please. Next, please. Once the interview has been done, the doctor as well as the nurses will put on their PPEs in the donning area. The donning area is located in the nurses station area. And then we will assess the patient if she is in the green zone. So that's the attire of the green zone, or in the red zone. Okay, but most of the time, as what I said, most of the time patients are examined at the red zone area. Next, please. Next, please. Okay, so once the nurses and the doctor are already wearing their PPE, vital signs are taken by the nurse. Next, please. So the doctor and the nurses will, together with the patient, will go to the examination room. Next, please. Next, please. That's the examination room, and that's inside the examination room. At what I said, we room of, so that's after examination of the patient, patient are instructed to wait at the waiting area, so for her medical certificate, while the doctor and the nurses will doff off their PPEs at the doffing room, and we also provided a shower room for them on the adjacent room of the doffing area so that they can shower off also. Next, please. So for our psychological services, we offer telepsychology, wherein patient can be interviewed by the psychologist. But in cases wherein internet is not possible on the client, we provided a room for them. As you can see on the right side, that's the playroom before. That's the playroom before. It was converted to the psychological room, and really proper and wearing of mask and face shield. Other psychologists, patient, as what the doctor also interviewed. And then before, we do daily endorsement from Monday to Friday, but we changed it into every Monday and every Thursday. And for those staff who cannot join us, they will join us through Zoom. Okay, and then I understand that almost every day there are issues that comes out since we are adopting this new normal. So that is why we continued our monthly staff meeting, and you usually do that every first Tuesday of the month.
All right. Thank you so much, Dr. Amadora. Yep. So we're kind of trying to compress all of the questions. We have 3 more questions. So I'd like to ask, pwede bang pagsabay-sabayin na lang natin yung mga questions? We can lump together. Yung question actually that's nasusunod is about access to services, and after that, can we ask also, how do you get your support? So for all of the panelists, so we'll start again with Baguio, Bataan, PGH, and then SPMC, and then Vicente Soto. Can you answer the 2 questions? magkasunod, access to services, and support. And what are, isama na rin natin, what are your insights about all the changes that are happening to the WCPU at this time? Let's start with Dr. Batino of Baguio General Hospital Medical Center. How do the clients access the services of your unit? So maybe just provide the contact details, and then how do you get your support, financial specifically and otherwise? Dr. Batino?
Okay, ma'am. Okay, Doc. Okay. The WCPU provided 2 hotline numbers and Facebook account for this purpose. Information dissemination was done through radio stations and BGHMC and WCPU Facebook page. Okay, to prevent COVID exposure, teleconsultation, telecounseling, case conference are conducted using various platforms such as Zoom, WebEx, Google Meet, and Doxime. To maintain data privacy, fills up in the Google form for data privacy. Our unit, which also is very helpful for other units, I guess, or really it's helpful. The telehearing has been a more convenient way to testify in court. One, it saves our time and also the residents' time. It does not compromise our schedule on hospital obligations. Secondly, it has a lesser financial burden both for me as a consultant and our resident, especially when hearings are being postponed. Thirdly, it is very advantageous to our clients, especially when they come from far-flung areas. Okay, to answer the question on regarding our support and from whom do we get our support, the unit is supported by the different agencies such as under the Department of Health, we have DOH Central, of course, DOH CAR, under DOH CAR, we have the Center for Health Development. RITM, they provided us the test kits for COVID. And under the LGUs, local government unit, we have the city government of Baguio, which is very supportive to us. Through the efforts of our very own hospital that we got our support.
Okay, thank you so much, Doc. Needless to say, you have hotline numbers and you have a string of support. Very good for you, Doctora.
Okay.
Yeah, and how about Dr. Kiat? Sa Bataan General Hospital, how do you give access? How do the patients access your services, and who gives you support? Dr. Kiat.
Yes, for the accessibility, we posted our hotlines in our website, the hospital website. Aside from disseminating the letters that I showed you earlier, we disseminated letters to the barangays and the police stations for our hotlines for coordination. And for what you saw in the slides before that, your accessibility, all are accessible. All are free still. Are the diagnostic procedures, the laboratory tests are free in our as long as it's from WCPU. And for the support, the medical center chief has been very supportive ever since the unit was established. So she made sure that the continuity of service will not be affected during this pandemic, and good partnership with the VAUSI officer of the barangay, the police officers during this pandemic is very important. And the transportation also, they were provided by the barangay, the police officers of their municipality. And for the insight, from the experience during this pandemic, teamwork is very important. The support of the medical center chief, the dedication of the staff in the unit, and the cooperation of the local government are important in delivering our services, especially during these trying times. Yes, that's why we were able to make mechanism we created mechanism in attending the cases.
That is so good. That is so good. Thank you, Dr. Kiat. So you mentioned teamwork, the support of upper management for child protection services, and of course that the community involvement.
Yes.
Thank you so much, Dr.
Thank
Kiat.
you.
Yeah. Dr. Tan, what is the experience of CPU PGH with regards to accessibility of services? Kumusta po ang financial support? And what are your insights regarding everything that has happened in light of the pandemic and how we are delivering services? Dr. Tan.
Quarantine should not limit our services to our clients. We are born in time with that, some such as this, since you know, we're the world is being so far but so near now. So we have our cell phones, computer, and internet. Our clients' access they can go through our online telephone calls, texts, or SMS. So we do telemedicine right now and telehealth, telepsych. PGH also created an online consultation request and appointment, or this is called okra system. So hindi yan yung okra na kinakain natin. Oo, but okra na ginagamit to have a consultation request for appointment. So soon we're going to use this for CPUs. So there are also 25 barangays telehub that will be created for us to reach the different barangays. And this telehub will be used as telehealth, case conference, and even for parenting purposes. For support, we are so blessed that our PGH director really support us all the way. So we're so blessed with Dr. Gap, who provide us the space and giving us waiting areas for the annex. And also, there are several organizations who blessed us, such as UNICEF, UNFPA, KNH, and ICTS. So we did some funding proposal to them, and they were able to grant us such funds for us to renovate and do the new normals at CPU. For our insights, we are in the challenging times right now where we experience uncertainty. But you know, we have to be open to changes, where you have to adjust to situations. We continue to have meetings every now and then and update staff and ask suggestion on how to improve our services. We have to be flexible to situations. If you need to cover one colleague, then you have to cover for that colleague. Kung nag-absent siya because meron siyang symptoms, may nag-ask sa question over, nagtinignan ko na yung question, sabi, what if one staff would have cough or colds? Syempre, hindi siya pwedeng pumasok. So the section head will have to ask for a reliever. Or kung kung walang reliever, then kung ako ang section head, I have to be there and replace the doctor. So we have to do things beyond what is expected to us from our job description. So we need to be flexible, helping one another and be a team player. And we have to be responsible and think of yourself and others. Now, always remind the staff, think of your patient, others, and yourself. Be mindful. Syempre, praying for safety and protection of all is very, very important. We still have to believe that hope is alive. Hope is there's a confident expectation of good. And look at the positive things that this pandemic brings to us. Soon this will come to pass. Thank you.
Thank you so much. So to add to all of yung mga insights from the previous speakers, malasakit and mindfulness, good combination, being flexible, and constant reminding. Kasi that we really have to involve everybody. Talagang all hands on deck. What about to Southern, as a SPMC, Dr. Lasala, kindly answer the three questions on accessibility of services, funding and support, and your main insight, kahit isa lang, on everything that has happened to the WCPU.
Okay.
Dr. Lazara.
Our clients and patients would usually access our services through hotlines, which were established by the administration. So these hotlines are open 24/7, And there is teleconsultation already available in SPMC through the platform of WebEx. So the Institute for Psychiatry and Behavioral Medicine, as well as that of the Department of Pediatrics and the Department of Obstetrics and Gynecology, have also their own hotline. So this can be accessed by our clients. And the next question is, where do we get our funds? Mainly from the hospital through our GAD budget. That's the Gender and Development budget. But we also receive support from the Department of Health, because we were already classified as a training center for WCPU. And for our insights, sad to say that despite of the pandemic and our children living inside our homes, thinking that our homes are safe havens, no, for our children, still abuse happens. But I would like to use what Dr. Vega, our then medical center chief, said, who is now the USEC, no, of the Department of Health. He said that we should look at things, everything, in the perspective of hope, hoping that all of this will come to an end, hoping that we will still be able to give, to provide a community that is free from violence for our children and the future population. Thank you.
And we got to keep on hoping, no? Kasi that will really give us the jet fuel we need to have malasakit, to be mindful, and to do all these things. We have to have hope. Yeah, and lastly, thank you so much, Dr. Amadora. Can you answer the three questions again? Accessibility, support, and main insights in light of the pandemic and WCPU.
Regarding accessibility, we have our email ad, and then all of our partner agencies are sending that one for appointment basis, not only through email, through phone, through cell phones. And then we had teleconferences during court calls, as well as telepsychology. Now, regarding to support, hospital also provided us with support because they were able to provide us 2 additional MO4 during that crisis, the COVID crisis. But we also got other generous organization for support, wherein one of that is the Franciscan Healthcare Crossing Borders. We made a project proposal, and they were able to give us a grant wherein we purchased the face mask, the respirator, the new examination for the green zone, and then we also were able to purchase the exhaust fan and the gooseneck light. Other than that, the vitamins, the masks, and cell phones, which is we really badly needed it for documentation purposes and for also taking, as well as other generous people provided us with loads, which is very important nowadays. Next, please. Other support also is from the Philippine Obstetrical Gynecological Society Incorporated, which has been our partner since 2015. They are the one help us for our advocacy, training, and seminar. But during the pandemic, all seminars, trainings were canceled. So that's why they provided us with medicines, antibiotics, face shields, and others also provided PPE. Because we were victims also of infection of this coronavirus. We had staff who's being infected. We became victim also, wherein we experienced discrimination. So it's understandable during the pandemic we're in, our concerns is really high, but there are people who stigmatizes, stereotypes patients who had positive COVID. So that's our one of the insights. And during those times we're in, we were quarantined. We packed our things. Others were isolated to be away with their family. We we hold on to each other for support. We had a chat group wherein we always make sure that everybody is okay. We give inspiration. We give all those encouragement for each other. And in fact, despite all that what happened, we were able to do training, our first subspecialty training for as a protection specialist last July of 3 doctors, 2 social workers, and 1 police officers. And lastly, we don't think we can overcome or surpass these things if we will we put everything to our God Almighty. So we surrender everything to Him for protection, for safety, for strength and healing. And this is last of our insight that we became a team. We are indeed a team, not only to our patients, but for each other's support. So this is picture was taken last May 8th of 2020, our 24th anniversary. We're still committed to serve our abused women and children. And we believe on equality for all. So as what this statement say, an equal world is an enabled world. Thank you very much.
Thank you so much, Dr. Amadora. We'll just jump into the question and answer. There was one question in Facebook, so I will just direct this to anybody. There was an observation. There was mention of that the social worker is to do the safety assessment of the patient, when in fact the social worker is mandated to do the initial assessment of the capability and capacity of the client to solve their presented problem. So please elaborate safety assessment. What do you mean by safety assessment? I think this came from the I think from Dr. Lasala. I think when you mentioned that the social worker uh, was the one to initially assess the patient.
No,
Can you?
ma'am. I said that it is our triage officer who usually assesses the patient for the possibility of having COVID or not, but it is not a social worker.
All right. So, yeah. I think we need to contextualize yung safety assessment dito. When we say safety assessment, for the one who asked the question, the context there is assessing the safety of the abused patient. We're not talking about the safety of all the patients who go into the hospital. So when we say safety assessment, it's for the patient. Assessment of safety of the patient. All right. So there are still other questions in the question and answer box. What is it? May tanong dito, will the companion of the child daw undergo COVID testing in your hospital? Someone asked that in the
Can I answer that?
Yes.
We don't do COVID testing for companions or patient. We just go by the health declaration. So yun yung ginagawa namin. Both the companion and the patient will give a health declaration whenever they go to CPU. Over.
Alright. So again, naka-base po tayo sa health declaration, right? There's another question in the Q&A box. Anyone can answer this. Are we not risking the health of clients who are not exposed to any COVID-related case to be examined in the red zone? I think the red zone, green zone is with the Pink Center of Vicente Soto. So the question was, aren't we exposing daw our patients, our client,
from the red.
Opo, if they are seen at the red zone?
Actually, at the height of the COVID pandemic in Cebu City, we identify hotspot areas, and almost everywhere in Cebu City were considered as hotspot area. So that is why we examine this patient if she belongs to a hotspot area at the red zone, even she is not COVID positive. But we assure you that after all examination, everything has been disinfected before examining another patient. So that's what we do usually.
Okay. So, yun, we need to clarify that also. For every patient na disinfection, yun yung isa sa common na practice, I think, across the WCPUs represented here. We're very mindful of disinfecting regularly after every patient. And then after that, may regular pang disinfection of the whole units in
Yes.
some, yeah, in some institutions. Thank you very much, Dr. Amadora, for clarifying that.
Thank you.
Dr. Tan, directed at you, or anyone can answer also, what happens to personnel with obosipon or chose not to report for work despite the schedule? Meaning, nakaschedule siya, tapos meron siyang ubosipon, or ano yung considerations, or paano kapag ayaw lang talagang pumasok ng personnel? I think
You
it's
know,
a,
yeah,
yes.
trust is very important to all staff. Kung wala kang pagtitiwala, mahirap 'yon kasi you don't give your mind na you don't let your mind enter yung doubt at this time. Very very important now is trust. So pag sinabi niya may ubot-sipon siya, then what is important is from that staff or from that personnel will call the admin officer. So admin officer, i-report niya, I have sipon or ubo, and then i-report yon sa UPHS or sa University of the Philippines Health section. From there, the UPHS will now get in touch with that staff. Gagawan siya ng telemedicine, mag-uusap sila, at doon ay titignan, is this staff high risk, low risk, medium risk? If high risk and medium risk, then that staff will be required to do a swab, naka-schedule yon. For the work naman, because kailangan mo nga magtiwala, so pagpahingayin mo muna siya, and then there should be a reliever for that personnel para hindi matigil ang function ng unit. And then yun nga, sabi ko nga kanina, kung halimbawa sa medical siya, wala na akong mahanap na doktor, then I have to go there as a section head of medical na to cover for that doctor.
And
so importante dito, is teamwork. And but yung teamwork, kailangan alam mo, flexible ka, may trust ka. Yun lang.
That's so true. Papasok yung ano talaga nun saluhan kayo kasi kayo-kayo na lang. 'Di ba? And really, trust is really necessary. Hindi pwedeng maging suspicious of co-workers. Dr. Lasala, there's a question here at the Q&A box. What is smart anti-pandemic booth? Can you elaborate? Ano raw po yung smart anti-pandemic booth, Dr. Lasala?
It's like yung parang X-ray machine inside the airport. You pass through it, it will scan the temperature, and it will get the features of that patient or the one who comes through it.
Wow, that's expensive, isn't it? But who funded that, Doctora?
I am not sure. I think it was given by some private agencies, I'm sure.
I'm fielding this question for everybody. Yung lalo na yung hindi nag-mention ito sa mga discussions. How is your experience regarding support of local government sa inyo po?
If I may,
yes,
be given the floor, please.
Yes, Dr. Batina.
Okay. With that, the support from our local government is really very, very good. To mention the city government of Baguio City, to mention Mayor Magalong, he gave hygiene kits to all the employees of BGHMC. And he also gave PPEs. He gave drugs and medicines. And from the office of the Congressman Go, he also gave several boxes of PPEs.
All right.
And from the office of Representative Eric Yap, we borrowed, or he voluntarily lent the the equipment for the molecular lab. And also, um, uh, I should not forget that we have support also from the City Health Services Office, or Baguio Health Department, used to be called. Yeah.
Right. Thank you. What about the others? Other doctors?
For Davao City, for Southern Philippines Medical Center, the city government is also very supportive since SPMC is the COVID center in Davao City. The mayor has given also PAPRs for residents and for some employees, no, especially the staff. And we also have PPEs also sent, as well as food during the height of the ECQ, when restaurants were closed and there was difficulty procuring the food for the employees. Hindi ko kasi nakakaya lahat ng dietary. So we had several agencies and some private people, private individuals who sent us food. So marami-rami rin po yung naitutulong ng local government to
Right.
SPMC.
Okay. Anyone else? So magaganda yung feedback natin ng support nararamdaman. How about the others? Meron pa po ba? None na? Yeah. There's another question here. Paano daw po yung gathering of information for clients? I think that was already mentioned, no? Dun sa protocol, ng mga paglalagay ng new protocol. So basically, where the common denominator will be consideration of safety, yung protection ng pasyente at protection natin. So social distancing, ventilation, minimize contact surface na touching. Yeah. And I like yung isa pa palang common trait natin, I think, na hindi pa natin na-mention, yung infographic and being able to communicate in many ways. So maganda yung practice na going to the community level using social media platforms, and even on-site, yung paglalagay ng mga infographics to remind people incessantly, continuously, na dapat may safety tayo na precautions. All right. We have some more in the Q&A box with the limited time that we have. What do you think is in the data presented? Sexual abuses was consistently higher than physical abuse, although in the September 10 preceptor, it was noted that physical abuse increased during the COVID. Several of us mentioned that there was an increase in sexual abuse vis-a-vis PA, and then in another institution, PA more for the women, and then sexual abuse more for the children. Can you comment on that? Bakit daw ang observation nung nagtanong, mas parami yung SA daw?
If I may answer that one.
Go ahead.
In our case, there is an increased number of sexual abuse compared to that of physical abuse. But actually, in reality, physical abuse are also increasing but underreported. Unlike in physical abuse, they usually go to the police, the PNP, and other partner agencies, and then these partner agencies will coordinate with us. And that's the time we were able to document and set an appointment. But in cases of physical abuse, indeed, there are women who are physically abused, but most of the time, because of inability to access transportation, the quarantine pass is only for the partner So those are the times they cannot access. They don't have internet connection, or others, they don't have phones. So that is why we noted that there is really a spike of sexual abuse compared to that of a very low number of physical abuse.
Other panelists would care to comment?
Can I answer that?
Yes, Dr. Tan.
You know, Nama, sa Pilipinas ay corporal punishment is still accepted. So maraming pasyente, they think this is discipline, which is not. So discipline is not equal to punishment. So yung iba, they think hindi ito dapat i-report, lalo yung mga bata and yung mga other parent. But right now, we see cases of physical abuse, even shaken baby syndrome sa CPU. That was done by, pagka malala kasi, that's the time they report. Pag hindi masyadong malala yung injuries, they don't report.
Right. Okay. So kapag ano na lang, parang sobra na lang. And you can also see rin naman that with yun din yung common with the ECQ, walang masyadong patients. And then nung naging mabigat, naging less ang restrictions, naglighten ng restrictions, then tsaka nagkaroon. Any last words that you'd like to impart to our watchers, to those who are viewing our live webinar? Again, let's just start from alphabetically from Baguio General. Dr. Batina, any last words? We're at the close. We're about to conclude our webinar. Dr. Batino?
One of my insights is that we have to be resilient. Secondly, the technology is really very helpful for in this time of COVID to reach out to our clients and to serve them with justice. Webinars kept us abreast as news and COVID updates serve as a learning tool for our lectures and training. And you have mentioned, Doctor, about the barangays. I want to just add up that on September 29, we want to reach out to our barangay policy desk officers. We will be conducting a webinar to help them learn on how to detect and recognize, report, and refer cases of abuse that they see. So we will be conducting that on 128 barangays through webinars. That would be on September 29. Okay. And I chanced one of these comments or statement in the New York Times wherein it says, and I agree very much, movement restrictions aim to stop the spread of the coronavirus may be making violence in homes and more frequent, more severe, and more dangerous, such that let us be aware of the dangers of this pandemic, which brings violence to our women and children. Right. The pandemic should not be a hindrance from protecting them. Thank you.
Tuloy ang Child Protection Services. Well said, Dr. Batino. Dr. Kiat, any last words?
Can you hear me, Dr.?
Yes.
Yes, okay. As we mentioned earlier, during these trying times, it is important to have a strengthened and good partnership with our other team. So from the barangay to the police, and it is very important to have a support. Of course, we need financial help for our unit. So the support of the government and the support of our hospital is very vital in this situation. Thank you.
Thank you, Dr. Kiat. Dr. Tan, any last word?
In these challenging times, it's very important for us to be resilient, as Dr. Batino said, and let us learn how to cope. With our anxiety and stress, hindi yung manonood ka ng fake news, makikinig ka ng fake news. At the end of the day, it's important that we know what is the right thing, what is evidence-based. There are lots of things na pwedeng uh, mag-change, but we have to cope up with those change. I saw in this chat, pwede daw ba ang medicinal plant? You know, maraming pwedeng mangyari. Pwede kong sabihin hindi ngayon, pero pa pwedeng oo in the next time. But ang importante, we keep uh, we keep on learning. Paano tayo mag-learn? We have to go to the right website, right resource person, hindi yung fake news. So I would suggest that you watch HIPAA, yung ano nila Dr. kahapon, nila Dr. Dance. Marami silang binanggit doon that would be beneficial for you. Also, before going to sleep, make sure you are happy para hindi ka papangit, hindi ka tatanda. You have to be well. Kasi it would also, remember now, immune system is the important defense natin. How can we increase our immune system? By being happy, not to stress. Kasi pagka the more unhappy ka, the more stressful ka, then your immune system will go down. But for WCPUs and CPUs, you know, we have to embrace this challenging times and then keep abreast dapat tayo and ready to do changes once it's there.
Right.
Okay, yun lang.
Stay safe, stay informed, and stay happy. Yeah, very well said. Dr. Lasala, any last words, Doctora?
Yes, ma'am.
Yeah.
I think for the past 5-6 months, we've been talking about ayaw natin maging positive sa COVID. But being positive with a better disposition in life, that would be better. So, takot nga tayo na maging positive, pero naman kung puro rin tayo negative, then at the end of the day, we'll just end up sleeping, not really a good sleep, no? And so what is really very important is that we should take care of ourselves. We cannot be taking care of other people if we do not take care of ourselves. So sabi nga, we should always have that perspective of hope. Matatapos din ito lahat. Hindi po pwede yung collateral damage. We're only talking about COVID right now. Everything in the news is COVID. But we forgot that there is collateral damage, no, for this COVID thing. After all this COVID, it's just a wake-up call. Siguro sa isang araw, we will wake up, tapos na pala si COVID. And yet, it has greater impact on the person because we were able to help other people. So, agree with Dr. Merle. Saludo pa rin ako kay Dr. Merle. Favorite ko siya during the CPU training. Kindness may be a very small thing, but it will work a very great impact on every person that you meet daily. So I think CPN, it's a good thing that we have this Ako Para sa Bata convention. We still need to say that the reports are down, the reports on abuse are down, but in reality, it is still happening, and we only have to continue to protect our children and our community. Thank you.
Thank you so much for that, Dr. Lasala. And lastly, Dr. Amadora.
Yes. I know everything. There's so many things have changed during the pandemic, during this pandemic COVID crisis. But I know that each one of us is struggling its own battle. But we always remember, we look at the blessings that we receive, even despite in this pandemic. And one important thing is our family, our friends, our staff, our teammates. And despite what happened, we are still here, serving our women and children, victims of violence. So that is very important. And never forget to pray for blessing, for for guidance, for strength, and healing. That's it. Thank you.
Thank you so much. And with that, we conclude this webinar. And we'd like to thank everybody who has participated. Our panelists, Dr. Batino from Baguio General Hospital Medical Center, Dr. Kiat, Bataan General Hospital Medical Center, Dr. Tan of CPU-PGH, Dr. Lasala of SPMC, and Dr. Madi Amador of Vicente Sote Memorial Medical Center. Thank you so much for your invaluable expertise and for giving hope and information to everybody.
Taguan